This is the healthcare track, and I am Michael Chevy Castronova. I'm the editor of Iowa Ideas Magazine. I'm also the business editor here at the Gazette. In this panel, we're going to talk about worker shortage in the healthcare sector. It's a issue in many, if not all sectors, but we're going to talk specifically about healthcare. Two things first. I want to thank our subject matter sponsor, which is the University of Iowa Hospitals and Clinics. And I believe we have a short message from the university at this time. Which we're going to see as soon as that gets spiraled up. You know, it's early. This is one of I believe, the first panel of the morning. So we're working out some things, but it will.
The COVID pandemic brought about exceptional challenges, such as worker shortages and healthcare disparities that really have changed the way we view healthcare. However, it has also highlighted opportunities for innovation and improvement. For example, we have seen a move towards telehealth, which helps us provide better access to care for all Iowans. We know that healthcare excellence is achieved through innovation and collaboration. And that is why we are a proud sponsor of this conference, and we are excited to hear your big ideas on how we can come together to improve quality of life and quality of care in Iowa. On behalf of the University of Iowa Healthcare, we hope you enjoy the conversations, make some great new connections, and leave inspired to help us shape the future of healthcare. Thank you.
Okay, thank you.
Take it away.
All right. And now I want to introduce our expert panel for this morning. They are from different aspects of the healthcare industry. So I'm going to go around my screen. And if you would each just tell us your name and your title, where you work, and just a little bit about what you do. Jen, who are you?
My name is Jen Boyd, and I am the Future Ready Curriculum Consultant for Grant Wood Area Education Agency in Cedar Rapids. My role it's kind of a generic role, I guess you could say. I support Future Ready initiatives for our region. We support 32 school districts, and a Future Ready initiative, there's a lot of different ways that you can define that, but essentially I see my job as helping to connect our students with futures that they are ready for, that they are interested in, and that will help our community. So it's kind of the big picture of the work that I do.
Okay, Terry, you're next on my screen. Good morning.
Good morning. Thank you. My name is Terry Voss, and I'm the Director of Work-Based Learning for a collaboration that goes by the name of WorkSmart Connector in Marion County and beyond, in southeast Iowa, in the Pella area. And we really focus on connecting area students to local careers. And that means that we rely on the employers to tell us what their workforce needs are and how we can best equip young people to fulfill those needs within our area.
Okay, thank you. And Carmen, joining us from Philadelphia this morning.
Hi, good morning, everyone. I'm Carmen Klein Smith. I'm the Senior Vice President, Chief Nurse Executive at St. Luke's Hospital in Cedar Rapids, a Unity Point Health affiliate. In my role, I oversee the practice of nursing across the organization, but along with the rest of the senior leadership team and our leadership team, a big focus is, how do we make sure that we are recruiting and retaining some of the best and brightest talent to deliver healthcare across all of the organization in all different job settings.
Okay. All right. So before we go any farther, I want to remind you watching, don't wait till the end to ask your questions. You can ask your questions. There's that little button at the bottom for chat, and just put in your questions. Those will come through to our room host. We here on the panel will see them and bring them into the conversation as we can. So here we go. Healthcare, as we know, is being affected just as so many other occupations are. According to SHRM, the HR folks that have their fingers on many good pieces of information, in April 2021, SHRM said 46% of HR professionals claimed it is difficult, that's their term, difficult to hire candidates full-time for high-skilled medical positions. We're talking about nurses, physicians, other kinds of specialists. Another 35%, it was somewhat difficult to search for and to find candidates for those kind of positions. So with that very frightening statistic, this is the first question for everyone. We'll just kind of go around on this. We've heard about staffing shortages in healthcare. How bad is it? Really that bad? Is it worse in other sectors? Is it especially true for nurses? Is it a particular field that's tough to hire for? And yes, I know that's a leading question. So who would like to just start talking about that first?
Well, maybe I'll take that one first, since I'm living and breathing in the healthcare industry. But
You are.
I think everyone can see that it's been difficult across all sectors, not just healthcare, but I think in all sectors, the ability to hire new talent, retain talent, fill some of our openings has become a little bit more challenging. There's lots of reasons for that. In particular, in the healthcare setting, we've been hearing for a number of years that we were going to be experiencing a big nursing shortage as the baby boomers started to retire. The average age of a nurse, prior to the pandemic was close to 50 years of age. And so as those baby boomers retire, who was going to fill that gap? Well, things have accentuated since the pandemic. And for lots of reasons, folks have maybe decided to retire earlier. Maybe folks have decided, nurses have decided they've wanted to go into the traveler nursing ranks, because during the pandemic that became quite lucrative with very high salaries. And you can understand nurses maybe had, loans to pay and different things they want to do with their school loans. And so went into the traveling corps and pulled those folks out of the hospital settings. Just a million different reasons, but I believe it is more difficult. We are having our applicant pool be less than it was in the past. Our turnover rates have risen a bit. They've stabilized, we feel, a little bit, but still something we want to really pay very, very close attention to, because I kind of share, when I got out of nursing school, that the place to work was in the hospital setting. That was the center of the universe. That's where all the action was, the better salaries, all the things that were being done in healthcare. But there's so many other opportunities now for nurses and other healthcare professionals to work in settings outside of the 24/7 environment that we have in a hospital. Great for people to have those opportunities, but it does create limitations in some of the other areas of healthcare that we're having a harder time filling with those positions.
Carmen, you mentioned a sort of aging out in the nursing profession. Maybe this is a dumb question. How is there like a usual, like you work until you're a certain age? I mean, what I do, as long as I have at least one eye and all my fingers, I can keep working. But nursing is a much more physical job.
Yeah, it is a much more physical job, and there isn't actually, a cutoff. People will work as long as they enjoy the work and feel that they want to continue in the role that they're in, or they may find, that's the other thing about nursing, there's so many different shifts, different opportunities, different settings of care that you can kind of, change maybe your work life balance and effort depending on, where you're at in your personal age, but there isn't really a cutoff. So we do think the baby boomers, they keep working hard. And how do we continue to use that wisdom that they bring to the work? And some things I'm going to talk about maybe a little bit further on here in the dialogue is how we can use that wisdom and talent going forward. Maybe those folks want to continue to work longer.
Jen, I see you nodding, and I know you're at the other end of the supply chain, for the lack of a better term. What do you think? How bad is it?
I work with our career and technical education teachers in the area, and high quality CTE, or career tech ed, is aligning the programming that we have in our schools with our labor market needs, right? And this is huge. So we spend a lot of time looking at data about what's going on. And I was just poking around in Iowa workforce development yesterday, and as of October 3rd, out of the 25 top job postings, 5 are in the healthcare world. 4 of the top 5 are healthcare related. So the most jobs we have available right now in Iowa are healthcare. And the employers with the most posted openings, 4 out of the top 5 are healthcare facilities. And so that data is striking, which is why we are having a lot of conversations from our K-12 world about what are we doing to address this and how are we helping to kind of fill this need. So the data is real, and we are seeing that in our K-12 system, and we're taking some unique approaches to really fill that pipeline and do our part to help create awareness, as well as pathways for students to follow to help fill some of these needs. But yeah, it's a real, true need. We are in a crisis.
Mhm.
Terry, what say you?
I would echo what's already been said, but one other additional point that I might make is that as a society, our population is aging right now as well, which even creates more demand on the healthcare industry in particular. I would agree that these workforce shortages are consistent across all sectors, but because of some of these particular needs in healthcare, it's exacerbated. And I was just looking at some data yesterday as well, just like Jen was doing in our specific area. And not only is there a shortage of workforce in this area, but there's been a 6% increase in medical industry related jobs just in our county alone. So in the midst of workforce numbers potentially going down, the demand and the increased need for workers is increasing. And so that creates a significant gap as well.
So you're saying there are fewer professionals, there is a growing need, and because there are more people who need the help because of the aging population, and you're saying there are more different kinds of professions than there used to be in healthcare. So the trifecta of not good things.
Right.
Okay.
That's exactly true. And then what we find in the student world is that students aren't necessarily aware of those needs. So young people are often, you might hear, I want to be a nurse when I grow up from some, but beyond that, they aren't aware of these new and evolving technologies and workforce needs that are occurring. So we also need to make those more visible.
Right, and we're going to talk about some of those fancy new professions later on. But before we started, Jen and Terry, you were talking about a high school apprenticeship program, a new one. We're talking about unique opportunities. Could you, both of you, talk a little bit about that? Because I don't know how widely shared that's been.
Carrie, why don't you start, since you're the model there, and then I can explain what we're doing with that in our region.
Yeah, certainly. Thank you. We've been working on an apprenticeship program, and we've been building out apprenticeship programs in various industries in our area for several years, but it soon became evident that an apprenticeship model in medical or patient care would be very beneficial to help young people understand the opportunities and kind of grow into those workforce needs. And so what we really created was an apprenticeship where students between their junior and senior year in high school can start a work-based learning opportunity. They work full-time that summer between those 2 high school years, and then they can go part-time as seniors, and then continue on for about 2,000 hours of work-based learning experience to get certified. Now, the certification is just kind of the frosting on the cake, if you will, because throughout this process, there are a lot of competencies that they're required to learn. A lot of Department of Labor checkpoints that students are mentored through to learn what they need to learn, but it starts with getting those basic CNA or certified nursing assistant credentials and skills, so that then they can take those skills into a variety of different workforce areas. So right now we provide a rotation experience for students to go through 9 different career fields, everything from phlebotomy to home health and hospice to OB, emergency department. They get to go use those CNA skills in all those different areas, so they get a sense of what they are best equipped for, what they would most like to go into. And they have the option of at any point pursuing a full-time work opportunity or continuing their education to go on to become an RN or whatever it is their long-term goals may be. So it's really a gentle way to help students to get introduced to the medical field and then explore. And then we found that given that visibility to the industry, they're even more intrigued and more likely to stay and gain full-time employment.
Because they get a real world sense of what it is rather than what they imagine it is, what they've seen on television.
Exactly. Now they have to get they have to meet criteria before they go into the program, and then they have to really have those specific skills and continue to gain those skills through the process. But in the end, being able to practice those skills throughout from those early ages really seems to be assisting with our retention needs.
Yeah, and a great point with the apprenticeship program is, we have this workforce shortage, but we have this whole pool of potential workers that are sitting in our high school classrooms right now, that a lot of them are kind of bored with traditional school, right? And they're kind of losing interest. And so it's a really good matchup of this pool of applicants that could help fill the needs. And so the other great part of it, while they're doing that on the job training, they're filling some of those roles that our healthcare facilities are desperately in need of. So once they have their CNA, they're in, serving the role as CNA, they're getting those hours as well. But they're filling, a potentially open position. They are learning, they're growing, they're getting loyalty with that company, right? They're that certain facility. I'm sure you can all remember where your first job was, good or bad, right? But, what we're seeing is that a lot of students that start with certain companies are sticking with those companies, whether they grow with them and add on and move into different healthcare roles. So it's really kind of it's beneficial for all that are involved. Students are engaging, they're sticking, they're graduating, they're being successful, they're moving into the career force, they're moving into post-secondary education opportunities instead of waiting till they graduate to kind of figure out, well, what should I do now? So we've kind of taken what happened, the Pella model and Grantwood AEA, we're serving as sort of an intermediary where we are supporting this new apprenticeship program for 15 school districts in our whole region. So we're kind of going at it region-wide to really make a big impact. And we received, a great part about this too, is there's a lot of funding out there from our state to help address this problem. So Grantwood was awarded a healthcare grant to get this program up and running, which has really helped offset the costs, not only for our districts, but also for our employers. There's funding that's going to actually pay our apprentices wages for up to 1,000 hours. So I know we're going to get into wages a little bit later, but there's a lot of benefits to this. So we are rolling out officially in January. We're going to start those placements and get this program up and running. But it's really great to see across the state that we're all seeing the same challenges and we're collaborating and duplicating efforts in order to really address this need.
And to address a question we have from one of the folks watching is how widely known this program is. There's a plan to spread this out, or are we seeing how it works? Because this just started, right?
Yeah, and I can jump in on that. So the program is something that we built and identified as a need in Pella and throughout Marion County in our 6 school districts. So we were kind of the launch pad or the pilot program. And when that became more visible, that's when the state agencies decided to make it a statewide effort. And so the grant really was the launch point that Jen mentioned, where other schools and other entities could apply for this grant. So that piece of it has already been put in place. Those awards have been granted. But our model in Pella and with WorkSmart Connector is that whatever we do, we're wanting to share that out. So for example, the process and a lot of the information related to our program is on our website, worksmartconnector.org. And you can look at just a lot of the steps along the way in terms of how our program is built out, the the pieces that students need to learn before going into the program. All of those things are largely on our website, but the goal is that we want to assist, and I think the state would echo the same. We want to assist other communities, other entities that are wanting to model and do the same. The grant pieces are something that, you know, we'll all be keeping an eye on as time goes on, but essentially the fact is that you can do this, grant money or not. And so I think that the model is a place to start, and then really develop it the best way that suits your particular community.
And Michael, if I can add in here, that is exactly, you know, a strategy that should work to perfection. You know, we have to get deeper and deeper into our community schools to, like you say, engage folks in healthcare and what the different roles are and what the opportunities are. And like you say, if you can get them connected with an organization or, you know, a workplace, that retention increases, because that's what we'll see too. You know, we work very closely with our community colleges and colleges and universities in the corridor. And what we'll find is if they've done a clinical, you know, if a student's done a clinical experience there, preceptorship there, those are the kinds of things that cause them to be attracted to stay in the environment. So a great program, and certainly what we need to recruit for the future.
Okay, and I want to remind those watching, we are now actually halfway through already. So if you have any comments or questions, please type those in and send them along. So we talked about giving participants, apprentices in your program experience in a variety of ways. And I heard the other day about a healthcare job that had never even occurred to me existed. It's about a skilled tech, an actual skill set that a tech would need to learn to clean an operating room. And it's one of those things that had never occurred to me. And of course, it makes perfect sense that you actually can't just go in with a mop and clean up. And I imagine there are probably lots of jobs like that out there for people who might want to help or be involved in healthcare, or, hey, that's a great hospital down the street, I'd like to work there, but they don't necessarily want to be a nurse or a doctor or take blood. And I'm wondering, are there lots of kind of jobs like that, and how do people find out about those? Carmen, you're in a hospital. What are there? Am I crazy? Are there all kinds of jobs I've never heard of?
No, you're not crazy. There are lots of jobs like that. You know, we have jobs in environmental services and plant operations, in IT technology, obviously in all types of areas. So yes, there are lots of opportunities, and I think through apprenticeships and through the program that, you know, Terry and Jen have described, being able to bring students in to see what those different opportunities are, therapies, respiratory therapy, physical occupational therapy, introducing them to those different types of roles and functions, I think is really, really critical to expose those different types of roles to people that may be interested in, like you say, working in a hospital system or a healthcare system, but not knowing exactly what all of those opportunities might be.
And I would add on, so I mean, we've all heard the saying that we're preparing students for jobs that don't even exist yet. And that's very true. I mean, telehealth wasn't a thing, and I love it now, right? Because you can just click your phone and have things taken care of most of the time. But, you know, as that starts to happen, you know, this, and what we hear from our employers a lot is like, we don't need them to have all of these really super elevated skills when they come to us. What we need are students that come in, that they're ready to learn, they can problem solve, they can get along. So we're seeing kind of a shift in our K-12 system to kind of address this as well, where we're focusing a lot more on some of those professional skills, a lot of that collaboration, communication. So it's not as much of your traditional, you know, learn these specific skills, memorize, repeat, you know, sort of a thing, but we're trying to teach them how to be agile because we don't know what their future workforce necessarily looks like. And the apprenticeship, before they get into that, they're getting a lot of that background so that they can learn this specific skill set, but then they can take it, they can adapt it as they move out, throughout their career, whatever that may be. I believe that they're expected to change jobs every 3 to 5 years, this coming generation. And if you think about that, that's a lot of different things that a student may be doing down the road. And there's not one skill set that's necessarily going to make them successful in that. So it's exciting, but it's also, that's an important thing for our schools to be thinking about right now.
I love the fact that the employers are also showing their agility through this process. So with our patient care registered apprenticeship, it's been really unique is that the medical employers in our area have been watching these students and also learning from them. So one of our employers, for example, the local hospital, actually introduced a new role or position based on what they saw and watched in terms of the talent pool that those young people bring into the workforce. So now they've started this new position called a patient care technician. And it was largely because of what they saw these young people could do. So it's fascinating how that agility is happening on both sides of the fence.
What is a patient care technician? Patient care. What does that person do?
I think it's basically a summary of all the different things that they've been asked to show or to use their CNA skills doing through the apprenticeship. So there's a lot of communication, as Jen mentioned earlier, a lot of relationship building, maybe helping the patient feel comfortable, and then just helping with those baseline needs that oftentimes the nurses and the CNAs aren't able to find the time to do. Now the patient gets that specific personal touch from the patient care specialist.
So that's the person who follows up after or checks in and says, so I see you're here for this today. How is that other issue where you fell down the stairs kind of thing? No, maybe?
That communication is a key part of it.
Okay. So we have another question, and this is about medical assistants, S, plural. We are losing a lot of medical assistants who are going to work from home for better work-life balance, maybe greater pay. Any recommendations for retention of medical assistants? And just, could someone define, do we think we know what this is meant by medical assistants? Is that everyone who's not a doctor? I realize I'm being silly.
Well, I guess maybe a little clarification on that. There are certified medical assistants, CMAs, different than a certified nursing assistant, a CNA, but CMAs have oftentimes been employed in some of our ambulatory clinics in those office settings. We're starting to see some of those move into the hospital setting now and use the skill set that a CMA brings to the table to supplement the care teams in the hospital setting. But I think the thing that's going to be key for any retention of any type of worker in the future is how we can continue to look flexibly with schedules set up, making sure we're fair and consistent, obviously, with pay and benefits, but looking at those things that can enhance work-life balance. And so traditional 8-hour shifts, 12-hour shifts, those kinds of things, continuing to look at how we can flex those schedules, maybe offer different types of benefits, maybe a smorgasbord type of benefits that meet maybe the person where they're at in their career. All those kinds of things, I think, are going to really enhance some of those retention efforts of any of our team members for the future.
And if I could just jump in, one thing I wanted to add to what was just being said is that company or corporate culture within different medical employers is becoming an increasing popular conversation. And I connected with a lot of our employers before this conversation today, and I heard that repeatedly, that they're working hard at making a company culture or a facility culture that is one that people want to be a part of. And that includes a lot of the things that was just listed. So culture is important.
Yeah, Terry, I would wholeheartedly agree with you on that. And as I was talking to a lot of graduating nursing students over the course of this last year, knowing that they're coming into the nursing workforce, being able, to command, good salaries and incentives, is that pay and benefit is really, really important, but every bit as important is that culture and the work environment, the team that you work with side by side, and how the organization treats you and supports you in your growth and development. I know a lot of them were really looking for, how am I going to be supported? And I think you're very right. That's key. That culture, the support they're going to get as they grow their careers is essential, I think, going forward.
Well, let me ask some questions about what could be impediments to careers. For one, and you just mentioned it, Carmen. Every sector, healthcare, whatever it is being affected by rising pay costs for workers. And we can talk forever, at least I do, about how inflation is a self-fulfilling prophecy. And we talk about it, we need more pay, so we give more pay, and that makes things cost more. But how much have you seen? Is there a rising increase in what people are getting paid, demand for getting paid, and how much is that really affecting everything else? Or is that a trick question?
You know, it's not really a trick question. I think over the course of this last year, we've seen our labor expenses increase probably 20% at least. And that has a lot to do with, again, incentives, travel costs for agency staff to help fulfill some of our vacancies, but also increases in base rates. So it is, we are seeing, you know, as I said, the labor costs increase, and we need to be doing that. We need to remain competitive. So that is occurring. Does that answer your question, Michael? Or
It does.
okay.
It does. So Jen and Terry, so from your perspective, are people are they looking at healthcare, and are they looking at these healthcare apprenticeships? They're obviously don't have illusions that they're going to become independently wealthy from doing this, right? I mean, what do you see as the motivation? And therefore, maybe that's what helps find more people to do that.
I read an article on Forbes. It was printed in 2021 about the COVID-19 pandemic and how it actually affected this young generation. And while a lot of us think that it might have turned them off to healthcare, the opposite in a certain study was kind of cited that that was the opposite of what was happening. It was actually encouraging them to go and be a part of it, and to actually be part of the solution. We have this generation is empathetic, and they care about culture. So earlier what you were talking about, that's how you keep workers anymore. And so we do have a group that is interested in it. And the work that Terry is doing with her group, that Workplace Learning Connections here in Quad Cities is doing, or in the Cedar Rapids area is doing, is critical for awareness of the different routes. I mean, so often we always would think nurse, doctor, that's healthcare. And it's not true. And so I think this pipeline is coming to fill the needs, but there's the awareness of what are all of the different jobs and which one fits with what you really like and what you care about. And if you are someone that doesn't want to be with my daughter wanted to be a doctor, and then she couldn't even watch bone videos in class, she would throw up. So I'm like, I don't think it's for you, buddy. And so, but it's creating that awareness, but then also understanding, we were talking about telehealth. Well, you got to have a computer science people that are putting that software and that networking together. So there's other ways to engage with the healthcare industry that aren't just some of those traditional paths. And that creating the awareness, we are seeing people that want to care for other people and they want to do something for society, and they're finding those avenues to do it. So we just we're just in the recruitment phase of our apprenticeship, and already first round, we have over 50 students interested that really have zero background in what this whole program is about. And we were expecting 10 region wide to get this started, and we're at 50. So we're pretty excited about that.
And I would say too, it's always been in recent years, a common theme that this incoming generation wants to make a difference. They want to have an impact. That's something that we so often hear from these young people. They're looking for ways to bring that to fruition and actually enact that. And so what better idea than to bring to them these medical field opportunities, if that's truly what they desire, is to make that impact, make a difference in people's lives. And so it's ready and waiting for them to pursue, but they often just need to know what that actually means in a day-to-day job.
Yeah, and I kind of, to play along with Terry and Jen, nursing, we've always called it a science and an art. There's the science and that goes into the diagnosis and the interventions and the treatments, but it's an art too. It's that empathy. It's how you communicate and relate. Same thing with the healthcare industry. It's a business, but it's a service industry. And like you say, people want to make an impact, and there's no better way in my mind to do that than as in some type of role in the healthcare industry.
And I so often think that for any of us, our primary role is to open doors. Those of us who are working with young people, or those who are wanting to find new careers or just grow in their own career, we need to be door openers and make that as accessible as possible. There are always challenges. I mean, a lot of us have gone through a lot of different challenges to get down our own career pathway, but to make all those opportunities as accessible as possible in terms of the training, the education, the experience, whatever we can do to make that easy or easier helps those young people find their way.
Okay, and I do want to remind those watching, questions, comments, please put them in the chat so we can get to this. So here's my hornet's nest question. And we've talked about licensing and credentialing a bit. And I read this somewhere that there is more licensing and credentialing than ever, particularly in healthcare. Is that true? And doesn't that hinder hiring? And here's the dumb question. Why are we doing that? Is that true? Is there more like you're seeing, you've all mentioned it. Are we seeing more of it? And why? What is it we need more credentialing for?
Michael, I'm not, I think where I would look at that is, we want to make sure that people are trained or competent, are licensed to their scope of practice. I mean, that's been historically in the healthcare industry for providers, is that they need to have that licensing, that certification. They've completed the training and they've tested and are credentialed to do the work. That's historically been the stance, and I don't think that really holds things up necessarily. I think that's a stamp of approval, and then we need to take each of those professions and make sure that we're allowing them to work at the top of their license. And I think that's a point for the future as well. We need to take those folks that have that specialty training, have those credentials, and make sure that they're able, to participate fully in that work that they're being asked to do. So I don't think it's a concern. I think it's something that we need to continue to maximize in terms of allowing top of license work.
And I would add too that.
I'll go. So I agree with Carmen, and a part of it too, and this may not be exactly what you mean, but there's this gap, right? We need people to fill these roles. So what can we do right now? And so what we've seen, we work closely with the community college. So we work with Kirkwood Community College here. And what we see is they're looking at their programs, and they're, the 2 or 4 year degree definitely has value. Absolutely. But there are other, like what Terry mentioned with the patient care tech, right? There's other kind of little bumps along the way that can signify that you have a certain level of knowledge and expertise to kind of give you a little bump up, right? So you're, they call them stackable credentials in some areas. And so we're seeing a lot of that emerging where people, instead of saying, I'm going to go to school for 4 years and then go out and do the job, I'm going to get this credential and then I'm going to work in this field, then I'm going to add this one on top of it. And now I'm moving up a level. And so we're seeing some of those kind of more different ways to approach it, where you can grow in small steps that are more attainable. We're in this immediacy kind of society. I want something on Amazon and I'm going to get it tomorrow, right? And so we're starting to see that kind of duplicated in our workforce. Looking at this long educational landscape is overwhelming for some. And so having little bites along the way where they're seeing kind of that progress, and then being able to grow their skill set in different ways versus just kind of one direction, I think is why we're seeing some more of those aspects, some of those different sort of routes.
Yeah.
And I was going to say some of what you were going to say too, Jen, but then adding to that, in visiting with employers and the educators that walk alongside training young people for these positions, quality is always a priority. You know, especially in the medical field, there's no doubt that everybody wants to do what produces the most quality, but at the same time, they're asking all the right questions. Not that we have solutions, and not that things have to change in some of these areas, but they're asking the right questions. You know, why do we have a shortage of nurses on one side, but we have a wait list of people wanting to get into these programs on the other side? Does it truly take an MSN to teach nursing? Just some of those questions. Maybe we'll find out that we need to be exactly where we need to be or where we are right now. But the fact is that we're exploring those opportunities and saying what best suits people that want to get into these fields, and the patient as well, is the right conversation to have.
Yeah.
So you've all talked about telemedicine and training for that, and that became a big thing during the pandemic. Is telemedicine here to stay? And part two, is that one more thing that people are going to need, and to get into healthcare, you're going to need to have to know how to work? Is it here to stay? I bet you're going to say yes.
I'd say yes.
Okay.
Yeah, it is here to stay, but it also provides great opportunity. You know, the technology advancements that occurred during the COVID pandemic, you know, are here to stay. And additional things to support the nursing profession is, you know, we're using virtual nursing. So you can have a nurse, not even in the hospital, watching a patient, providing education to a patient by, you know, using, you know, technology to have that conversation, to support new nurses on the night shift, to use those resources of our more tenured, experienced staff that can help train and guide and develop the next generation of nurses. So we're starting to see that at St. Luke's, where we're using virtual nursing to help with our discharge instructions, our discharge education. We're going to see that continue to proliferate. And then the telemedicine as well, creating additional resources to have providers available to help see patients. Now, does it create a little change in some workflows? Yes. But again, this is how we're going to evolve some of our team members, our patient care techs, our CNAs, our CMAs, different folks to participate on that collaborative team that will take care of a population of patients. So I look at it as being a very positive thing for our future. And again, I think as we have new folks come into the healthcare industry, these are things that will be attractive to them as well. They understand technology pretty easily. So,
Jen, Terry, is telemedicine a part of your apprenticeship program?
There's not a specific telemedicine portion of the program that we've developed. However, all of the skills, nearly all the skills that you would need to use in telemedicine need to be applied throughout the apprenticeship. So it would make it very easy, or again, take down an obstacle and open doors for students that want to go that direction, to take what they've learned through the apprenticeship and apply it there.
Okay. I want to remind people we're now in the last 12 minutes or so of this panel. If you have any thoughts, comments, questions, now is the time to type those in at the bottom. So Carmen, this might be more a question for you. During the pandemic, we read a lot about burnout, particularly among nurses, but I'm sure it affected lots in the healthcare field, and about something called compassion fatigue, which affected lots of people. Were just like, okay, enough of this. Is that still an issue? I mean, how do you even prepare for a challenge like that?
yeah, I think the last 2.5 years have presented all kinds of challenges for us in that regard. Obviously, the patient volumes that we started to see, the acuity of the patients we were seeing, all those things in the early parts of the pandemic, particularly the caregivers that were caring for these patients, a lot went into that. And then as we started to come out on the other end, and now we're running into difficulties with having the staffing folks that we need to fill all of the needs, that continues to wear on our teams. You know, it's just like, is there an end to where we can get back to where we used to be? And we're not ever going to be back to where we used to be. So how do we help support the team? You know, we can talk about resilience, but at what point in time, you know, do we just need to, you know, this resilience wax? We have really been focusing on what are ways that we can re-engage our teams and what brought them into the work to begin with. And we have a program that we started here this summer that we partnered with Creative Healthcare Management from Minneapolis with a program called Reigniting the Spirit of Caring. It's a 3-day program that really focuses on the first day, you know, looking at, you know, how we care for patients. Second day, family members.
Hey, Carmen, you cut out a little bit there. I'm sorry. It focuses on.
I'm sorry. It focuses on how we re-engage with why we went into healthcare or the profession that we chose in the first place. Really focusing on, in the 3-day program, focusing on self, focusing on each other, focusing on patients and families. Really a powerful program. We take team members that sign up for it out of the hospital environment. We've been doing it at Indian Creek Nature Center, completely separate from the workplace, and reconnecting again, helping to support people, debriefing. Those types of efforts are the things that we're really investing in our team members right now to help them get back to, you know, where they feel that they're resilient and strong and ready to take on our next challenge. But a big piece in supporting our teams. Workplace violence is a big topic with our environments across the healthcare industry, but helping folks get through this constant challenge of real sick patients and you know, tough work day in and day out. We need to support them every way we can. So that's an effort we've been embarked on here this summer.
Carmen, I love hearing that this is a full circle moment for me, because some of what you're talking about that you're visiting and discussing with veteran employees are ones that we're also talking about with students in elementary school and middle school. And, you know, through things like Leader in Me and helping them find their full potential, we're having those same conversations with young people, helping them think about how can I best fit into the society that I'm a part of, and how can I be most effective, and what career will allow me to best use my skills most effectively. So it's happening in your world with people who have been in the workforce for a long time. It's happening in our world before students even get there. So it's exciting to see it's a continuum.
Yeah, great, thanks.
So I also read, in doing research for this panel, something about this whole notion of recruiting non-active talent. I assume that refers to people who used to be in the profession and who are not in the profession anymore. They also use the term, I think, passive. I'm not sure what that means. Have you heard of those things, Carmen? Is that something that's actually a consideration?
Yeah, we actually, over the course of this last year, reached out to team members that had retired or resigned over the course of the last 2 or 3 years, try to encourage them to come back and, you know, some capacity and look at the different opportunities we had available and how they could help support those. I don't know if we got a lot of return from that. I can say we didn't necessarily get a ton of return from that, but I believe that we really do need to engage folks. And if they're interested in healthcare, we can help them and train our own. We've been doing that a lot as Terry and Jen talk about patient care techs and CNAs. We're trying to do the same thing. As if we can get them into the organization, we have our own program that can teach them how to be a CNA so they can take the certification exam. Even bringing new RNs in, you know, if they were students during the pandemic, their clinical time was cut short and slimmed down quite a bit during the pandemic. So, you know, we want to make sure again that we're supporting them to grow their careers. So we believe that if someone's interested in healthcare, they want to make a difference, we can help plug them into programs in our community with our resources in the community, with foundation funds that would help provide for scholarships. We're very willing to grow our own, not necessarily coming in with a specific degree, depending on the job.
I think
So-
kind of what we're hearing
ahead,
is
Jen.
this whole idea of innovation, as well as focusing on those employees. I think we're seeing now with this huge shortage that employees are not just lining up. We don't necessarily have our pick of the crop or cream of the crop pick, you know, anymore. It's we need to do some recruiting to get them in. And I think listening to those employees, like what we just heard Carmen talking about, setting up those, you know, taking them out of the workplace and giving them some of that focus is really what's changing the game. And so finding those innovative practices, having an exit survey when folks leave and really reading the results, or focus groups about ways to change things is you know, our students, we know in our schools, our students want to be heard. And when their voice is heard, they're more invested in the work that's happening. They, you know, their behavior changes within the schools, and it's the same in our workforce. And so I applaud what you're doing, Carmen, and the steps that you're taking, because it is a shift from the way things have always been done, but it's a shift that has to happen in order to continue being able to offer the services that we need.
So let me ask you this then. So, and maybe Terry, I'll start with you, but it's probably for everyone. What would you tell someone? What do you tell someone? What do you tell a student who says, I'm interested in healthcare in some way? What's the elevator pitch that you would give them about why it's a worthwhile thing? Or do you say, well, you know, it's really hard and you should really think about this? What do you tell? What would you tell them, Terry? What do you tell them?
I always encourage them at any age to go ahead and explore it. One of the unique things about these programs that we're building out is that students can go explore these fields and not just start and stop with nursing, but all the other elements of being in the medical industry as well. Go explore it, because likely there will be an opportunity that suits you. But by trial and error, more trial than error, I should say, they get to see what opportunities are out there, explore it, and find the right niche for them. If they have skills that align, if they have an interest, if they're even asking the question, chances are that there's an opportunity for them in the medical field.
Jen, what do you tell them? What do you say?
Well, one of my first questions is, well, why do you want to do that? Or what do you think, what led you to this conclusion, right? Because that's going to give you a lot of indication of why they're thinking that. So if they're like, well, I want to make lots of money. Okay, well, let's you know, let's retract. And
they don't say that in journalism, trust me. Yeah.
Or education, right?
Yeah.
But can you handle blood and all that? So figuring out why they're saying what they're saying is step one. And then from there, really having a conversation with them, as Terry mentioned, what are you like, what are you interested in? What kinds of things would appeal to you? And getting them out to explore. You know, I feel strongly that we don't have enough healthcare education courses in our junior highs, or even our high schools, just high school level courses. We have a lot of great concurrent enrollment. We work great with Kirkwood, but there's not a lot of exploration right now in many of our districts across the state. And so kids don't really have a clear understanding of what's out there. So I firmly believe that starting, I love what WorkSmart Connector does, starting in those lower grade levels in the elementaries, getting them out, having experiences so that by the time they get to that junior high school age, they have some clear vision. But always, what's your plan? Why are you going there, right? What do you like? What are you interested in? What are you good at, to kind of help them navigate? But I also would applaud them, because healthcare is such an important need. We all have it. We all want to make sure those people taking care of us, whenever that may be, are highly qualified, care, and can communicate, right? All the skills that we have been talking about.
So Carmen, you work at a hospital, you probably get asked this a lot. What do you tell people who might be interested?
Yeah, I've been making that pitch for a few decades now. So yeah, Any opportunity I get, I would do the same, you know, find out what they're interested in. But I also have the privilege of being able to line them up with a shadow experience, you know, and like you say, until you kind of see what it would entail and how the work is done, you can't really maybe make a good decision. So I'd like to, you know, job shadow folks with some of those people in different roles that they could experience and learn from, and also to encourage them to think, you know, I think Jen talked about earlier, how you can stack educational opportunities to get to, you know, a goal. And there's so many programs and academic opportunities throughout our corridor that we could, you know, point them in the right direction then once we know where they want to be. So I like to get them in the environment and line them up with someone to really learn, you know, more
Show them
about
the
what
real
they're
world.
asking about. Yep.
Okay, really quick, we have a question from one of our viewers. You, Carmen, spoke of a 3-day workshop for veteran nurses getting to think why they wanted to become a nurse. You mentioned a company. She said you mentioned a company you're partnering with. What company was that? Is the question.
Creative Healthcare Management in Minneapolis. And it's not just for tenured nurses, it's for everyone. And first of all, we wanted to get most of our managers there because they've been through some challenges too. And then the managers can help us get our team members there. So it's for anyone.
Okay, the name of the company one more time. You said Minneapolis.
Creative Healthcare Management.
Okay, thank you. All right, well, we are in fact at time. Again, I want to thank the University of Iowa Hospitals and Clinics, the sponsor for this healthcare track. I want to thank our room host. I want to thank our panelists. I want to thank those of you watching. Remember, there are many more panels and speakers across a variety of tracks for this year's Iowa Ideas Conference. You can watch them right here. That's today and more tomorrow. So please keep watching and thank you. And I'll see some of you later today.